Introduction to anatomical positions and terminology lecture for first year medical student. So first, what is anatomy? Anatomy is the science of structure and functions of the body. So we have some anatomical positions which called anterior, posterior, prone, supine, inferior, superior, medial, lateral, proximal and distal. So what is mean by anterior, posterior? Anterior means towards the front of the body and posterior means towards the back of the body. If you could see in screen, the anterior is one facing the front and the posterior is facing the back. What is prone? When body is lying face down in anatomical position. ठीक है, जब आपका फेस नीचे होता है, नीचे की तरफ डाउन साइड होता है, तो आप वो होता है प्रोन. एंड इन स्पाइन व्हेन बॉडी इज लाइंग फेस अप, दिस इज कॉल्ड सुपाइन पोजिशन. जब आप एनाटॉमिकल पोजिशन में होते हो और आपका फेस ऊपर की तरफ होता है, तो वो उसको हम कहते हैं सुपाइन. नाउ another anatomical position, superior and inferior. So cranial means the skull and upper part of the body. So when we dealing at the top would be superior, ठीक है, and one at the bottom is inferior. Example, when we talking about head, so head is superior because ऊपर की तरफ है and arms are inferior. But when we talking about legs, so legs is inferior and arms are superior. Why? Because arms was inferior when I was taking head as reference point. Okay, so head would be superior to arms and arms would be inferior to head, but arms would be superior to legs and legs would be inferior to arms. So that this is called superior inferior. You always take as some reference point. This is and this is called the superior and inferior. Now we have another anatomical position which is called medial lateral. Medial means that is close to body. Let's suppose we have central point and its central part, and any part which is close to body would be medial, and any part which is away from the body is lateral. Got it? Again, जब भी सेंट्रल पार्ट के बीच में जो भी क्लोज होगा आपका बॉडी पार्ट वो मीडियल में आएगा, और जो उस मीडियल या फिर सेंट्रल पार्ट से दूर की तरफ होगा वो होगा लेटरल. एग्जांपल, लेट्स टॉक अबाउट स्टर्नम. सो स्टर्नम इज मीडियल but it's away from the body and away from the midline, that would be lateral. So medial is towards the body and the lateral is away from the body. Next is proximal and distal. Proximal, towards or nearest the trunk or point of origin of a part. Example, proximal end of femur joins with the pelvic bone, and distal is away from the trunk or point or origin of a part. Example, the hand is located at the distal end of the forearm. I have used the term here. What is trunk? Trunk means an anatomical term for the central part of human body. So your Simran is here and I have defined all the anatomical positions here. If you have any doubt, comment. Thank you.